Okay, welcome everyone to the Innovators Mindset. I have Mary Jo Gorman here. She's the CEO of Healthy Bytes. Mary Jo, thanks for doing this on short notice. I really appreciate it.
Oh, great to be here. Thanks, Vic.
So talk to me about what you saw in the marketplace as COVID-19 kind of hit all of us. What did you see from the dietitian kind of healthy eating point of view?
So before COVID hit, we had a major national problem, which is the obesity epidemic, the diabetes epidemic already in place.
Yeah,
And
and
so
we've seen if you're overweight, you're much more susceptible to really be in trouble if you get COVID.
right. And that's true too. Exactly. So we already have this population issue. And Healthy Bites was in the process, and still is the process, of offering nutritional counseling to people who are employed through their employer in order to help them meet this challenge of obesity, diabetes, high blood pressure. And as you may know, this isn't something where you have a one-time visit and everything is miraculously changed. You have to have information, make some changes, but over time it works all the time.
Yeah, you really need to change your habits that you've probably grown up with for 20, 30, 40, 50 years. You have to change those habits.
Well, or maybe you had good habits and somewhere along the way you got into some bad habits you need to change back, right? So, but you're right, you have to take action. But a lot of people don't even really understand what action to take, and it makes them frustrated.
Yeah.
And in the weight industry, I would say, I don't think it's done us any favors. We have a lot of misinformation, a lot of people trying to tell us things that actually aren't very scientific or factual. So our team of professionals, they're trained in nutrition. They know what to do. They can really help people get facts and really make changes.
Yeah.
So we're on the path of bringing that to people. And our call point is the employer HR department. So when COVID hit, obviously they have a lot more things on their mind than nutritional counseling. They are worried about moving a whole bunch of people home or protecting their employees from being infected, redoing schedules. And so one of the things that we were able to do, partly because that COVID now allows nutritional counseling to be done with telemedicine, we decided to start offering that immediately to help people wherever they might be.
Yeah. So maybe it's dangerous. Maybe they're not allowed to get in. Maybe they just can't make it there. They now can see their expert dietitian advisor virtually.
That's right. Exactly. Exactly. And there's a lot of reasons that telemedicine hasn't been adopted more broadly, and a lot of my career has been in telemedicine. But one of the reasons is because the professional is not paid at the same rate as if they have an on-site or person-to-person visit. So with the COVID regulations, they have equalized that. So it's the same price to the employer or the employee that it would be if they were seeing somebody face-to-face, and it's the same payment to the provider. So that encourages everybody to just go ahead and adopt.
Yeah,
So
and it feels to me like the value is the same, right? The teaching and learning and advice is the same. And so it doesn't make sense to have the reimbursement be any different.
that's right, exactly. And that's particularly true for things like registered dietitians, and mental health is another great example.
Yeah, yeah. Okay, so tell me what Healthy Bytes did to sort of help with allowing this to be possible virtually.
So we as soon as the ruling was made, we had a couple things that we had to do. One, we made some major changes to our website so that people could make an appointment really easily through the website. We were actually in the process of installing a new electronic medical record for the company, so we accelerated getting that done so that people could have access. And that included training our registered dietitians very quickly for this. And then we started reaching out to people in our networks and letting them know that we have this availability. And we started seeing patients within about 3 weeks of the ruling coming out.
Yeah, wow, it's incredibly fast. And so how has the uptake been? Do people like to engage virtually?
Yes, people are really, really enjoying this. First of all, if you wanted to see a dietitian, it's hard to find somebody who's on your health plan. It's hard to figure out where their office is. You have to make a trip there or not there. And you think it's important, but you might not think it's as important as, say, taking your kid to the pediatrician or something like that. So this just makes something that is really necessary to people a lot more available.
Yeah, and there's not a lot of testing or interactions the dietitian does. So you can be very successful virtually, just like we're talking now. It's learning, it's education, it's sort of giving them advice.
Right. Because the interaction is really about how they're eating, what their patterns are, as you said, their habits, and helping them find those goals that they can tackle these things one at a time and little by little change things until those small things add up to big impact.
Yeah. Yeah. Excellent. Okay. And so talk to me about what about from the provider side, from the dietitian side? Like, are they able to engage this way? Is it changing the way they practice?
Well, it is a little, but not that much. I mean, unlike some other practices where you're used to actually touching patients, whether it's a physician, you're going to examine somebody, you're going to put your hands on them. Dietitians, it's always a conversation with the person.
Yeah.
And so they really find it very easy to use, and they've slipped into it quite easily.
Yeah. Okay. Excellent. And so tell me what you see as the future. Like, is this going to really enable this advice and dietitian nutrition counseling to be more broadly adopted? Maybe bring it to settings where there aren't a lot of dietitians around, or other countries, or more broadly in the US?
So one of the things that we've always thought is that a really good model would be to see the dietitian maybe in person, but have some of those visits be with telemedicine.
Okay.
So
like a combination a little bit.
Yeah, a combination of things. Partly because once you have that coaching experience or that personalized experience with somebody face to face, you've established a slightly better relationship than you can if you're 100% on a Zoom call. And so having that to build on, we think can have a lot more continuity for the patient and can have them have a lot better result because they're continuing to sustain the relationship.
Yeah.
This does broaden where people can receive it. So a provider can see patients in anywhere in a state in which they're licensed. So I might be in Dallas, but I could see somebody in Austin with telemedicine because I'm licensed in Texas. So this makes it a much more broad opportunity for individuals.
And maybe just not Austin, but if you take West Texas or something, as a provider, I might go out there once a month and build rapport with patients, knowing that then I can see them on an ongoing basis virtually.
Exactly.
Where it would be difficult for me to do that if I had to always go out there and see them in person.
That's right. Yeah.
Okay. Great. Well, Mary Jo, thanks for doing this. I really appreciate it. Is there a website or somewhere where people can learn more about what you're doing to Healthy Bytes?
Yes. So our website is healthybytesinc.com. And we would love to hear from people and hear their comments, or they can go there and make an appointment with one of our great dietitians.
And it's BYTES, is that right?
YTES.
Yeah, healthybytesinc.com.
That's right.
Okay. Mary Jo, thanks for doing this. I really appreciate it. It's a great story.
Good to see you, Vic.